Hi, everybody. Today, our focus is going to be on special senses, with the focus mostly on eyes and ears, with a brief overview of the gustatory sense as well as your olfactory sense. Let's go ahead and get started. So sense of taste, basically your taste buds are about 4,000 taste buds that are located on the surface of your tongue, which considering the number of neurons that we have throughout the body, 4,000 is not that many. However, within those 4,000, you still have the ability to differentiate 5 different tastes. The 4 that are listed first, which is sweet, sour, salty, and bitter, are kind of common sense. But we also have something we identified as umami. Umami means savory. So foods that have a specific type of component called monosodium glutamate, which is better known as MSG, these components allows us to consider something to be more savory than others. So certain cheese, beef, and seafood that are rich in amino acids will have a higher concentration of MSG naturally, and therefore they feel more savory to us. Do note that, unfortunately, many manufacturers of fast foods have started to add MSG directly to their food to make it taste better, even though it may not seem very appealing. Now, this is a view of where you can find your taste buds throughout your tongue. Do note that this is where you have higher concentration of a specific type of receptors for your sense of taste, but that doesn't mean you will not have the the different type of receptors within that region. What does that mean exactly? So let's say in this picture, it says your sense of sweet or the sweet taste will be sensed at the tip of your tongue. Does that mean that you won't taste sweetness on the center of your tongue or the back of your throat? No, you still will sense it, but it will not be as strong as what you will feel in the tip of your tongue because you have a higher concentration of those receptors localized to the tip. Again, you see sour more on the lateral aspect of the tongue, salty more anterior, bitter kind of in the back of your throat, close to the end, and then umami is more centralized on your tongue. Now, when it comes to the sense of a smell or your olfactory, you have between 10 to 20 million olfactory receptors, which compared to 4,000 receptors for your sense of taste, gives you an idea about how much stronger your sense of a smell is compared to your sense of taste. So, considering the number of the receptors, do note that 80 to 90% of what we as humans identify or perceive as taste is actually the smell of the food, not the actual taste associated with the gustatory sense. So I always tell my students, think about this as you have a cold. A lot of food tastes very bland to you because usually if you have a cold, you have congestion, which prevents you to utilize your full sense of smell. Now, in terms of what gives you the capacity to create your sense of smell, these are modified versions of the neurons, which have a cluster of cilia on its ends, and they interact with other molecules. And through these interactions, these neurons get activated. Kind of depicting right here, this space you see is your nasal cavity. You do notice that on the superior aspect of the nasal cavity, we do have these branching of the neurons, and these branchings of the neurons are basically those modified neurons that give you your sense of smell. It is not labeled here, but please do note that the structure you see right here is your olfactory bulb, and the extensions coming off of that would be your olfactory tract. Now, One last point, which I think is extremely fantastic and fascinating, is that a lot of times a specific senses can trigger specific memories in your mind. And the main reason for that is the fact that your olfactory bulb is directly tied into your limbic system. Remember, limbic system is the one that basically gives you the capacity to create memories based on the emotions. It gives you your sense of fear, or gives you the stress or pleasure associated with the specific experiences. So sense of a smell would be the strongest in terms of creating those emotions because it is directly connected to your limbic system. Now, again, these are the two senses we discussed. Is pretty brief. I don't expect you guys to know anything more about your sense of smell and your sense of taste. Now, moving on, we're going to focus on the sense of vision or your visual senses. We are starting with anatomical structures of the orbital cavity, your eyelids, and the layering that are present within your eye. So the proper vocabulary for eyelids is palpebral, and you have one main muscle that gives you the ability to lift up your top eyelid. It's referred to as levator palpebri superioris. And again, look at the word levator as in lifting, palpebri as an eyelid, superioris means the top. Do also notice, and you can also visualize that on your own eye, that when you look at your eye, or if you invert your eyelids, you'll see this very clear, shiny layer that covers the surface of the eye and your eyelid. This translucent layer is called conjunctiva. It is a mucous membrane. And if it's covering the surface of your eye, it's called the ocular conjunctiva. And if it's covering the inside of your eyelid, it's called palpebral conjunctiva. You do have a sac that is associated with these structure, which your conjunctiva, called conjunctival sac. And again, it's associated with palpebral and ocular. Here is a visualization of the conjunctiva. Here is the palpebral, as in it's covering the inside of the eyelids. And then if it's covering the surface of your eyelid, it's your bulbar or ocular conjunctiva. Now, the next structure that's associated with your eye is your tear duct and your tear apparatus or tear production apparatus. The word lacrimal implies tears. So in this picture, what you see in red is depicting the lacrimal apparatus that with the main goal of keeping the surface of your eye moist. So we start with the lateral aspect of the eye with what we identify as the lacrimal gland. So it's this structure right up here. Lacrimal gland is going to produce and release the tears into these tiny branching you see, again, on the lateral aspect of the eye, called excretory ducts. Now, most of the tears does come off if there is enough fluid or extra fluid. Let's say the person is crying. The extra fluid can literally just fall off the eyelids. However, some of the fluids do move, some of the fluid does move on the surface of the eye and reaches the corner or the medial aspect of the eye and open up, which opens up to a structure called lacrimal puncta. This is a tiny opening, is unidirectional, as in tear can get out, but no fluid can come to the surface of the eye. And lacrimal puncta opens up to these tiny channels you see on the side of the eye called lacrimal canaliculi. These are, again, tiny channels that are collecting the extra tears. These structure, the lacrimal canaliculi, open up into the lacrimal sac, which continues down the nostrils into the tube that you see right here called nasolacrimal duct, and eventually again release out of the nostrils. So please do note the path of the tears moving through the structures. For one more time going over them, you start with lacrimal gland, which empties into the excretory ducts, goes over the surface of the eye toward the medial aspect, reaches the structure or the opening called lacrimal punta, empties into the lacrimal canalicula, and then eventually into the lacrimal sac, nasolacrimal duct, and out of the nostrils. Now, when we talk about the eye movement, you do need to understand that there are a total of 6 extrinsic, as in muscles that are around the eye and are controlled by your nervous system. And these muscles are responsible for creating rotational movement of the eye or moving your eyes up or down or left and right or medial or lateral. Now, before I move on and look at the movement of these muscles, I want to look at some of the vocabularies here to make sure everybody's on the same page. So we're not looking at the name of the muscles right now, we're just looking at the vocabulary that describes the function. So we have the word abduction versus adduction. Again, abduction means moving away. So if your eyes are moving laterally, that's describing the abduction movement. And if your eyes are more moving medially, as in toward your nose, that's adduction. Depression versus elevations are self-explanatory. Depressing means moving your eyes downward, elevation moving your eyes upward. And again, if you hear the word laterally, that still implies abduction, versus if the eye is moving medially, that means adduction. Now, the name of the 6 muscles, 6 extrinsic muscles, are also pretty easy to remember. So if you have your eye, I'm sorry for the shape, but you have muscle right here, you have a muscle right here, you have a muscle up here and down here. All these muscles are straight muscles, so we are going to use the word rectus to describe them. Now, if it's on the top of the eye, this one, this is called the superior rectus. If it's on the bottom of the eye, it's called inferior rectus. If you assume your nose is right here, this is medial rectus, and this is your lateral rectus. You also have 2 oblique muscles. So one oblique muscle is on the top. Oh, actually, I'm sorry. This actually moves this way. So this is moving this way. Ignore that line. And then you also have a muscle down here. So this would be your superior oblique, and this one down here would be your inferior oblique. So again, 6 muscles total, 4 are rectus and 2 are oblique. So what kind of movements do these create? So let's just start with the first one. Lateral rectus is going to abduct your eye. So here's my lateral rectus. Give me 1 second, guys. So lateral rectus is going to move my eye laterally, right? As I'm away from the nose. So abduction of the eye. Superior rectus is going to elevate my eye, right? Moving it up, and adduct my eye. So it's creating this motion. Again, up and in. Inferior rectus is going to cause my eye to move down and what? In. And medial rectus logically would move my eye medially or adduct my eye. Now, what about your superior and inferior oblique? They are actually going to do the opposite of what we describe in terms of their name. So when we're talking about the superior oblique, look at what it says. Depresses the eye, which means moving the eye downward, and what? Laterally. And your inferior oblique is gonna move your eye, inferior is gonna move your eye up and what? Out. So if you're looking at the movement, the four rectus are pretty easy. They follow the same direction as their name, and the superior and inferior have a secondary movement, which is basically moving the eye toward the nose or medially. The superior and inferior obliques, literally, if you think about them, they are inverse in terms of their function. So if it's superior, it's gonna move the eye downward, as in depressing the eye and moving the eye outward. And if you're talking about the inferior oblique, inferior means down, but it's actually gonna move your eyes upward and out. So it creates a rotational movement for your eye. So moving on, here's basically the picture kind of highlighting the same muscles. So you have your superior and inferior, lateral and medial rectus. And then on the side right here, you see the superior oblique and then inferior oblique down here. Now, some of the conditions associated with the eye, one of the one is called strabismus or lazy eye. This is when the eyes are supposed to move in the same direction to be able to see the same object. If you do have lazy eye, then one eye is affected, as in one eye moves more medially or laterally with respect to the normal eye. So this is a result of either a weak or paralyzed extrinsic muscle. So one of the muscles that we discussed, one of the 6 muscles, is not working properly. And it is relatively easy to fix. In terms of if you're younger, they typically allow you to wear a patch to strengthen the muscles. Sometimes you do need surgery to fix the problem, but in many cases it is considered a treatable condition. Now, moving on into the anatomy of the eye. One of the first things we want to understand is that your eye is made up of 3 layers. Anytime you hear the word tunic, tunic implies layer. So the way I ask my students to understand this or think about it is you will have 3 layers. The outermost layer, its goal is to protect eye because eye is extremely sensitive. The second layer is the layer that is going to provide nourishment and oxygen for the eye. And the third layer, which is the innermost layer of the eye, is the layer that gives you the capacity to create vision. So, what are the names of these layers? The outermost layer, which is the job is to protect the eye tissue, is referred to as the fibrous tunic. The middle layer, which is responsible for nutrition and oxygen supplies, is vascular tunic. And the innermost layer of the eye, which gives you your sense of vision, is sensory tunic or retina. Let's take a deeper look at these structure. For fibrous tunic is the structure of the layer that is most visible to us in terms of the white of the eye. So white of the eye is basically known as a sclera. It is also the point of attachment for the 6 extrinsic muscles I mentioned earlier. Now, if the sclera comes in front of the eye, the white color is transformed to a translucent color which form a structure called cornea, and you can see it bulging out in front of the eye. Cornea has two main characteristics. One, it's avascular, as it lacks any type of blood vessel. Because it's associated with vision, you do not want to have any blood vessels that may hinder your capacity to create your sense of vision. However, it is highly innervated because you basically want to make sure you protect the tissue, right? Most of these receptors are identified as pain receptors to make sure, again, you don't poke your eyes and hurt your eye tissue severe enough that you lose the ability to create vision. Now, going back to the avascular function of your cornea, an interesting fact about this is that this tissue relies on receiving its oxygen directly from the air, and it receives its nutrients from the fluid that is found right behind the cornea called aqueous humor. So if I'm looking at this picture, here's my cornea. This space you see behind your cornea is anterior cavity, which is filled with a fluid called aqueous humor. We'll talk about that later as we go through the PowerPoint. So fibrous layer, again, what's depicted in blue? Cornea, as in front, the translucent layer, and surrounding the eye, the white of the eye is your sclera. The second layer of your eye is known as vascular layer, and it is made up of choroid, iris, and pupil. So what is choroid? Choroid is literally the middle layer of the eye. It has a significant number of blood vessels, which is basically provide nutrients and gas exchange for your eye tissue. The color of this layer, typically people look for a red color, but the reality is that this layer is really dark because it contains a specific type of protein called melanin. Melanin is the same type of color pigment you find in your skin, and having a lot of these melanin in your eye allows your vascular tunic to absorb any extra light that may be bouncing inside your eye and affect the final vision that your eye can create. So the goal of the choroid is to have a dark color to absorb any extra light and help you create the best image you can. Now, if you take the choroid layer, which is basically this layer you see right here in red, follow this and you come to the front of the eye, you form this colored portion of the eye right here, which is referred to as the iris. So iris is the continuation of the choroid, as you can see in the picture. It does have colors on it. However, the actual structure is made up of a smooth muscle. More specifically, you have two different types of a smooth muscle. One is identified as circular, and the other one is identified as radial. At the center of your iris, you have an opening, literally a hole, called a pupil. And the job of the pupil is to allow the light to pass through. The size of the pupil can change based on the involvement of the circular and radial muscle of the iris. So earlier in our lectures, we learned about sympathetic and parasympathetic nervous system. And one of the effects these two branches of the autonomic nervous system have is on the pupil size. So if you are dealing with a fight or flight response, which is also known as the sympathetic branches of the nervous system, the radial muscle, which is the outer muscle of the eye, will be activated. And the goal of these muscles, as they contract, is to open up the pupil, or in another sense, dilate the pupil, and allow more light to come to your eye and give you the ability to create a better image. However, when you're dealing with a rest and digest or food coma condition, which is the parasympathetic branch, the circular muscle, which is immediately to the pupil, are going to be activated, and they literally twist to create the pupil that is smaller than normal. And this constriction of the pupil literally limits how much light passes through the eye. So be careful when you study this. I do expect you guys to be able to distinguish between the two iris muscles. You also need to know that the radial muscles are engaged during the sympathetic and the circular muscles are engaged during the parasympathetic activities of the nervous system. Now, in terms of the ciliary body and how your lens is being held in place in the back of the eye, it is involved two structures, what we identified as ciliary muscles or ciliary body, which are also smooth muscles, and tiny strings that comes off of the ciliary muscles called suspensory ligament. So in this picture, what we identified as ciliary body or muscles are these structures at the end. These little strings you see right here would be your suspensory ligament, and the central body right here would be your lens. So you can imagine that the ciliary body that you have here and the involvement of the suspensory ligament gives you the capacity to change the thickness of the lens and allow this lens to focus the light on the back of the eye where your retina is. We'll go into details about this in this slide. So, changing the shape of your lens to give you the capacity to focus on the object properly is referred to as visual accommodation. Now, visual accommodation can be accomplished for objects that are close to me or objects that are far away from me. If the object is close to you, with the help of ciliary muscles, your suspensory ligaments are going to relax, and through the relaxation, make your lens more round, allowing you to focus on the objects that are near you. However, if you're focusing on objects that are far away from you, ciliary muscles are still involved, but their involvements actually cause the suspensory ligaments to be pulled. So your suspensory ligaments are becoming taut. As a result, they are going to pull on your lens and stretch your lens, and that allows you to focus on the distant object compared to when you look at close objects. So here is a depiction of visual accommodation. Here is when you focus on near objects. Notice the lens is more round or thick. Suspensory ligaments are relatively relaxed. And here is the other end connected to the ciliary muscles. When you focus on objects far away, you notice that the strings are, or your suspensory ligaments are taut, and they are pulling on your lens, making your lens stretch and giving you a capacity to focus on objects far away. Now, last thing we're going to talk about for this PowerPoint is the three homeostatic imbalances. Basically, if you have, or if you're in the need of glasses, you probably will have one of these three conditions. One is called myopia, which is nearsightedness. So in this case, as you can see in the picture, your eyeball is more oval, which allows the light to focus in front of the retina rather than farther away. So focal point is in front. In terms of hyperopia, the lens, the shape of your eye is more or smaller, And therefore, the focal points where all the lights focuses on is in the back of the eye. So in either of these two cases that are mentioned, because your focal point is not directly on your retina, where your image is supposed to be created, the image will be blurry on either case. Now, interesting fact about them is that you can correct these problems by adding a corrective lens to your vision, and this corrective lens allows the light to focus exactly on your retina, which is the back of your eye, rather than in front or behind it. The other condition people may have heard of is astigmatism. Astigmatism is when you have an uneven curvature to either your lens or to your cornea. Either of those conditions causes the light not to properly focus on the retina in a specific locations. Therefore, they may see some things as clear and the other parts as blurry. And again, this is also another condition that can be fixed with corrective lenses. Here is basically giving an idea of what the vision would look like if you are dealing with myopic or hyperopic vision. So look at the normal vision. Everything is clear. Everything is in focus. If you're myopic, as a nearsightedness, you can see objects near you, but far away is a blurry. Hyperopic, which is farsightedness, the near objects are not clear, but the image far away from you is clear. And here is astigmatism. Again, you will see kind of those double line or blurriness throughout your image. Okay, I'm going to stop the lecture here and we'll pick up this lecture on the second part of the special senses.